Eye strokes can lead to permanent vision loss. How is glaucoma related to an eye stroke? Hi everyone, I'm Dr. Nagori. I'm a board-certified ophthalmologist and a glaucoma specialist, and you're watching the iFacts.com channel. Today I want to talk to you about glaucoma and its potential to cause an eye stroke. We'll also discuss why it's so important to get your eye pressure checked regularly when you have glaucoma. So first, let's understand what glaucoma is. Glaucoma is a group of diseases that affect the optic nerve. In this disease, typically your peripheral vision is lost slowly over time. Having high eye pressure is one of the biggest risk factors that leads to vision loss in this disease. Now, as I mentioned, vision loss from glaucoma does tend to be gradual, but there are other conditions that can lead to sudden vision loss, like acute angle closure glaucoma. So how is glaucoma related to having an eye stroke? The term eye stroke is sometimes used by ophthalmologists to refer to something called a central retinal artery occlusion or a central retinal vein occlusion. A central retinal vein occlusion is sometimes abbreviated as CRVO. And in glaucoma, if the pressure is very, very high, this can contribute to having a central retinal vein occlusion, which is an independent process from the glaucoma itself. In a CRVO, the central retinal vein, which is responsible for draining blood from the retina, becomes blocked. The blockage can then lead to a buildup of blood and fluid inside the retina. This can cause vision problems, including sudden vision loss that may not return. A CRVO is similar to a stroke because it involves the interruption of blood flow, but instead of occurring in the brain, which is what we refer to as a stroke, it happens in the eye. Now, there are certain risk factors that can make you more likely to have a CRVO. Adults over age 50 are more likely to have it, and you can also be more likely to have a CRVO if you have other chronic conditions like high blood pressure, diabetes, glaucoma, and arteriosclerosis, which is hardening of your arteries. So if you or someone you know starts to experience sudden blurry vision, it's really important to get them to see the eye doctor right away. A CRVO can result in retinal swelling, bleeding into the retina, and significant vision loss, as mentioned before. This is in contrast to the gradual vision loss that we see in glaucoma. Also, the vision loss in glaucoma, as mentioned earlier, tends to be peripheral. In a CRVO, the vision loss is often central. High eye pressure, which can be seen in glaucoma, is sometimes associated with this problem. This is why it's so important to manage your intraocular pressure with the help of a doctor. Regular checkups and follow-up with your eye doctor are super important if you have glaucoma, and even if your pressure was normal at the last visit and your doctor was very happy with how you were doing, it doesn't mean that it's going to continue to stay normal even if you are taking the same medications. Sometimes glaucoma can get worse over time, even when you're using the medications like you're supposed to. Early detection and treatment of high eye pressure can prevent the progression of glaucoma and also reduce your risk of having a CRVO. So protect your vision by scheduling regular eye exams, not missing your appointments, and following your treatment plan as you've discussed with your doctor. Remember, it's also really important to not miss doses of your medication and take them as scheduled. Remember that vision loss from glaucoma is permanent, so it's really important to make sure that we are preventing any further vision loss. Also, vision loss from a CRVO tends to be very permanent as well. There are cases where some of it can be recovered, but generally patients tend to experience a very significant decrease in vision. Thanks for watching. Hope you found this helpful. Remember to subscribe below, and I'll see you next time.